In this video, we're going to talk about what I believe will really be a game changer when it comes to torso feminization. So we're going to talk about a new procedure. We're introducing it later in my year to my practice here in Miami, Florida. For you guys who don't know me, my name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon. And so that procedure is rib remodeling. And I think especially for trans femme patients, it's going to make all the difference. So you may have noticed some celebrity pictures like this on the internet recently where folks are getting impossibly tiny waists. And you can see this is the same celeb, not in my practice. I don't know if they've had surgery or not. But you can see what a huge difference this is. And also, it kind of helps illustrate what we're typically trying to do when we do torso feminization. So usually with torso feminization, we're trying to decrease down the hip to waist ratio. So rather than having more masculine type straight up and down lines on the silhouette, we want wide hips and a narrow waist. And ideally, we want that ratio to be under 0.7. In this person, it's even a lot lower than that. And traditionally, how we would achieve this was with liposuction. But in many patients, especially in trans feminine patients, sometimes this just isn't good enough, especially in folks who don't have too much fat or tissue there to begin with, that we may kind of have unsatisfying results and we still have that kind of up and down look overall. So with rib remodeling, you may have heard of rib removal. There are rumors over the years about various celebrities having undergone rib removal, and indeed that was done, but it wasn't very common and it was considered somewhat extreme. The awesome thing about rib remodeling is we don't actually take out that rib, so it's a lot less what we call morbid and painful, and a lot less likely to cause complications and with lesser scarring. So instead, what we do now is, depending on the patient's anatomy, target certain lower ribs. We do a gentle break in it, usually from what's called a percutaneous technique, meaning that we're doing it under ultrasound guidance and we're infracturing the rib. So we're bringing it in and then we're having our patient in a corset for a few months after surgery to remodel the ribs that are already there. So they're not coming out, but this is an absolute game changer in some folks, and we can lose between 3 and 4 inches to the ribs themselves. Thankfully, it's not a very painful procedure. We do it under general anesthetic. A lot of patients will combine it with another surgery. For example, it could be combined with breast augmentation or top surgery at the same time. In many folks, it may, if you have fat there, it may be a good idea to reduce down the waist further to do liposuction at the same time, or even a tummy tuck if you have a lot of loose skin and you could benefit from that. Typically, most folks take about 2 weeks off for a procedure like this. More obviously if you're adding in another procedure, but this is definitely one to watch, something I'm excited, like I said, to be bringing to our practice later in the year, and I believe is going to be such a game changer for trans feminine patients.